98.1, Love Music, Love Life. If you just joined us, you are just in time. It's time for Smooth Health. And today we're going to be talking about something very interesting. We're talking about blood disorders. So if you're out there and you want to be a part of our conversation, please, you can reach out to us on our various platforms. You can send us messages to 0809-444-0981. I'll say that again, 0809-444-0981. You can also call the studio lines. Call the number 0144899181. I'm giving vouchers today. Vouchers courtesy Evercare Hospital. It's worth 10,000 naira for free consultation. Today we're speaking with Dr. Ademola Adewoyin. He's a consultant hematologist, and basically he's currently a consultant hematologist at Evercare Hospital, Lekki, and his core clinical competencies include clinical hematology, anemias, bleeding disorders, thrombosis, blood cancers, and transfusion medicine, and also laboratory medicine as well. Also, in addition, he also runs quality management systems, healthcare leadership, and he's done so much as far as leveraging technology is concerned. Hello, sir. Good to have you here today.
A pleasure. Thanks a lot.
Great. Good to have you here. Okay, so like I mentioned, please call us on 0144899181. So let's just dive right into it, shall we?
Sure.
So, who is a consultant hematologist? That's the first question. And also, what is your role as far as that is concerned with Evercare Hospital?
Right. Thanks a lot for that question. Now, a consultant hematologist, as the name implies, is a physician, an expert or specialist physician who does involve in diagnosis, treatment, and prevention of blood and blood-related disorders.
Okay.
Yeah, and that would imply entities like anemias, blood transfusion-related problems, coagulation problems, bleeding disorders, and blood cancers. Yeah, so all these are what the job description of the consultant hematologist is in a clinical system.
All right, thank you very much for that. But okay, so we've mentioned a number of things. You mentioned anemias, blood disorders, and they all sound foreign to a layman like me, and I'm sure some people out there. But let's talk about it though. What are blood disorders, and also what is the process of diagnosing blood disorders at Evercare Hospital?
Yeah, so blood disorders, like I said, we could cite a few of them. So one very common blood disorder in our nation is anemia, and that essentially refers to shortage of blood. The other common blood disorder is cancer. So there are specific cancers that affect the blood. Typically you hear things like leukemias, lymphomas, myeloma. The other very big broad area of blood disorder we should mention is bleeding. So there could be inherited bleeding problems, like the hemophilias. There could be acquired bleeding problems. There could also be clotting problems, and that one that readily comes to mind is the DVT. So many of us would have heard about DVT, pulmonary embolism.
What does DVT stand for?
Yeah, so that happens when there is abnormal activation of the clotting mechanism within the limbs, essentially. So you have clot. So typically, you have blood flowing in a fluid state, and activation into the solid phase is only happens once there is a problem, like there is some sort of transection or some sort of cut of a blood vessel. Now, when that happens without any normal or physiologic activation, that is what we call thrombosis. Now, thrombosis can also evolve, when there's dislodgement of a part of that clot and result in embolism. So embolism is when there's dislodgement and that clot goes to another part, typically the lungs, and that's why we call it pulmonary embolism.
And this is a common case?
When you say common, yes, it's a common cause of death in certain situations. In fact, it's one of the things that we usually prevent in hospital settings, especially inpatient cares, because that can happen if not prevented.
All right, like I mentioned, if you just joined us, Smooth Health is what you're listening to. It's brought to you by Evercare Hospital, and you can call the studio lines to be a part of our conversation. 0144899981. I'll say that again. 0144899981. We're giving out free vouchers today for consultation, and also WhatsApp messages come to 0809-444-0981. So at least now we know who a consultant hematologist is, and we know, we have a background understanding of what blood disorders are and also the processes of diagnosing them. But let's talk about blood cancers, okay? Now, it's said that they occur when abdominal blood cells begin to grow out of control. Can you, walk us through this? What's that about?
Yeah. So that occurs when abnormal cells evolve and they grow out of control. So the word cancer in itself comes from a root word that means crab. So these are cells that have lost their sense of being regulated. So they sort of become autonomous and they begin to grow out of control. And they have a tendency to spread out of the origin and involve other organ systems.
Let me just cut you short for 1 minute there.
Sure.
And let's see who this is. Hello?
Hello.
Hello. Good evening.
Hi, good evening, sir.
Hi, good evening. How are you doing?
I'm doing fine.
What's your name, please?
Okay, my name is Emeka.
Hi, Emeka.
Okay.
Do you have a question for our doctor today?
Yes, I have.
Okay, go on, please.
Sir, please, due to the nature of my job, I normally sit for a long period.
Emeka, can you speak a little bit louder? Because we can't hear you, though.
I said, due to the nature of my job, I sit for a long period of time. So, I don't feel I have this regular flow of blood. Does it have the long-term adverse problem to our health?
Yeah, thanks for that question, Emeka. Yes, potentially it does. And why it does is because sitting for a long time or being sedentary causes pooling of blood in those parts of the body, and stasis or pooling of blood is one of the risk factors. So typically that happens once there's an interplay of a couple of factors. So yes, it's important to get up and do some exercise. For persons that do a lot of long distance travels in excess of 6 hours or long flights, it's very important to move around to prevent the DVT.
All right, Emeka, I hope that answers your question. So before we took the call, you were talking about DVT, and you were talking about cancers as well.
Right.
So please walk us through that.
Okay, so again, I should mention that cancers are genetic diseases. So they would often happen because of a genetic accident. And once it happens, and there is propagation of this occurrence, like I said, they also have a tendency to involve other organs. And then once that begins to happen, then the patient begins to get symptomatic. So typically in blood cancers, you may not get much of mass effect. In some of them, like lymphomas, you see swellings, what we call bean-shaped swellings. The lymph nodes are swollen and they tend to be not painful. And then these cancer cells can spread to the bone marrow. They suppress the bone marrow. And so some persons will have things like anemia. They will have things like bleeding problems. Yeah.
But how do you diagnose for such?
Now, diagnosis begins with a suspicion. Now, in some of these instances, it's actually an incidental finding, and that's why we recommend regular health checks so that this can be picked early. Now, diagnosis involves a couple of procedures or protocols. One, if it's emanating from some sort of complaint, yes, you talk to the doctor gets the history, the doctor also gets to examine, and some of the things that could be found on physical examination includes the lymph node swelling, there could be anemia or pallor of mucous surfaces, the eye, the mouth. Now, beyond that, we also deploy laboratory techniques. So we get to do a couple of blood works, so full blood count, essentially. And then, of course, oftentimes for blood cancers, we also get into the bone marrow. So we get to do the bone marrow examination. And then that would be followed by a couple of other high-falutin investigations. So I don't think I want to bore us today with, this big terminology.
Maybe you are going to bore us eventually, because there might be some people out there that require this information. But if you do, though, please reach out to us, like I mentioned, up on our WhatsApp platform and also studio lines 01448991. That's the number to call. Also, send your WhatsApp messages to 0809-444-0981. Now, I'm giving, Evercare is giving vouchers, 10,000 naira vouchers for free consultation. So we're giving it to the first 3 people that send in messages or call the show with questions, okay? So the first caller, though, please send in your details, because you are the first winner for today's show. You just spoke about, sitting for a long time, and the doctor just responded to your question. But that said, doctor, let's talk about facilities, shall we?
Sure.
Okay. So, what facilities are in place to treat blood disorders, particularly at Evercare Hospital?
Right. So, one, I should mention that the personnel is highly specialized and very competent.
Okay.
So we have a pool of very experienced healthcare team, ranging from the clinicians to the oncology nurses to other support staff. Then number 2 is that we have diagnostic arsenal or weaponry, if I should use that term. So we have what it takes to be able to pin down a diagnosis. Typically we begin quite broad, and then we begin to narrow down before we are able to pin down a diagnosis. So ranging from the full workup of hematology laboratory test to the chemistry test to the histology test for lymph node histology. And then we can also provide a lot of support in terms of transfusion support, because oftentimes cancer patients will require a lot of transfusion therapy.
Okay.
So apheresis is available. Different specialized blood components are also available for treatment of these diseases.
All right. Thank you very much for that. Now, I know that, one of the reasons why, from research and experience, one of the reasons why Nigerians shy away from, diagnosis or, going into hospitals for testing is because some of them assume that some of these treatments are painful. The diagnoses are painful. So, can you walk us through, like you've mentioned the processes, but are they painful? Is it something to be worried about?
Yeah. So, interesting question. Yeah. Right. Yeah. So, some of them are potentially painful. That's the way I'll put it. Now, for instance, if you need to do as simple as a blood work, absolutely a needle needs to introduce into the vessel. So that comes with pain. Now, the same thing applies to something
that's mild
like
pain.
Right.
That's mild pain.
Correct. Now, if there are going to be instances of significant pain, then we can numb the area. So you want to do something like bone marrow aspiration. Of course, we need to numb and deaden the area so that the pain is not felt. The same thing applies to stuff like lymph node excisional biopsy. So we have to deaden the area. But of course, the way we think, it's a question of benefit risk. So of course we need to make a diagnosis, we need to offer and provide treatment, and then we need to be able to harvest these tissues to be able to do this. Yeah. So potentially some pain, but can be managed.
Right. All right. If you just joined us, by the way, Smooth 98.1 is what you're listening to. Smooth Health is the show. Very special guest in the studio is Dr. Adewoyin. He's currently a consultant hematologist at Evercare Hospital, and his core clinical competencies include clinical hematology, anemias, bleeding disorders, thrombosis, blood cancers, and transfusion. And so far we've been talking about, all the processes that go through blood disorders. So if you're out there and you want to be a part of our conversation, like I mentioned, send your messages to 0809-444-0981, or just call the studio lines. Call the number 01448991. Okay, so let's talk about blood donations, right? So some people, some people don't believe in blood donations. Some people believe in blood donations. Some people have myths about blood donations. They say, hey, if you've got some type of piercings, tattoos, all of that good stuff, or different stuff, you might not, be a good candidate for it. But I want to ask you this. What is the importance of blood donation to healthcare? And also, Does Evercare Hospital operate a blood bank and donor drives?
Right. So briefly on the importance of blood donation, we all know blood is life. Okay.
Hello? Hello?
Hello.
Hi, good evening.
Good evening.
Hello, what's your name?
Hello, good evening.
We can hear you. Go on. What's your name, please?
Hello, good evening.
Hello, how are you doing?
I am fine.
What's your name, please?
Yeah, I'm Abisola.
Abisola, where are you calling from?
Calling from Ketu.
Okay, so do you have a question for the doctor?
Yes.
Go
I
on.
want to ask. He talked about cancer and the treatment and diagnosis and evaluation. So, what are the predisposing factors? Like, what are we supposed to be careful about? What are we supposed to run from, and that we think can cause cancer or can lead to it?
Is that your question, Abisola? That's all?
Yeah, that's
All right, thank you so much, Abisola. By the way, you also just want a voucher from Evercare for free consultation, so we would like for you to send us your details, okay?
okay. To this number.
I'll announce the number in a few minutes, okay? But thank you so much for that. Before you respond, doctor, let's see who this is.
Okay.
Hello?
Hello.
Hello, good evening.
Good evening. I want to know that, sir.
Yes, this is Smooth 98.1. What's your name, please?
Okay, my name is Nazi.
Maybe?
Calling from Lekki as well.
Okay. So do you have a question for our doctor today?
Good evening, sir.
Yeah, good evening.
Yes, I have a question.
Please, we can't hear you though. You have to speak louder.
Can you hear me now?
Yeah, we can hear you now. Go on, go on.
Okay, fantastic. Okay, my question is, what can we do? Okay, we were talking about...
Oh, wow. Maybe we're we're really struggling to hear what you're saying.
Wow. Can
Okay.
you hear me now?
Is it better?
Better now.
Is it better now? Hello?
Can you hear me now?
Yes, go on.
Okay, fantastic. Okay, so I said, you were talking about blood flow and blood clots and things like that. So I was asking, is there anything particular we can do to stop that? Like, what are the things that could aid blood clotting as the case is? That's just what I want to say.
So repeat that part, the last part. What are the things that can what?
What are the things that aid blood clotting? Like
Okay.
blood flows to the joints, things like that. What
Okay.
are the things that
Sure.
All right, thank you. Thank you so much, maybe. One more call just before we... okay. All right. Let's... Maybe you can answer the questions now.
Okay, yeah. So for Abisola's question on the causes of cancers. Now, generally we know that cancer, the causes are unknown, but there are what we call risk factors or predispositions. And we tend to look at them from different categories as well. So there are the physical agents, things like exposure to irradiations. You also talk about chemicals, toxins, chemical exposures, insecticide, petrochemical products, organophosphates, So these are some chemical predispositions that could cause or induce genetic damage, and cancers can evolve from that. Now, for the other bit I should mention is that there are also biologic agents, stuff like infections, microbial infections, that can also drive evolution of cancers. So as it sounds, the way to prevent cancer is to, as much as possible, live clean, eat healthy diet that is clean from toxins, and then try and be infection-free as much as possible. So non-infections like hepatitis are known to also promote cancer. So we can, as much as possible, avoid those.
All right. Thank you so much, doctor. Let's see who this is. Hello. Good evening.
Hello, good evening.
Hi. Good evening. How are you doing today?
I'm good. My name is Timothy
Hi, Timothy. Where are you calling from?
from Motion.
Okay. So do you have a question for Dr. Ademola?
Yeah, I do. I've never donated blood before. I'm like, let's say I'm scared. Is there like a side effect to not donating blood?
Interesting question. Yeah. Okay. Yeah. So, well, there is no side effect to donating blood, because before the donor donates blood, we have to ensure safety of the donor. Okay, so if you come in to donate and then we take you through the process and we found you to be a safe donor, then with all pleasure, you're not going to have any adverse side effects. Of course, for those that are not safe enough to donate, we can defer them, counsel them, and then offer them additional support so that they can be better candidates for donation.
All right. Thank you so much, Doctor. If you called the studio, first 3 callers were giving vouchers to those callers. So we're giving vouchers to Abisola, Miebi, and Timothy. So please send us your details to 0809-444-0981. I'll say that again, 0809-444-0981. You've won vouchers courtesy Evercare Hospital. And like I mentioned, if you just joined the show, Smooth Health is what you're listening to. We're talking about blood disorders. Very special guest today is Dr. Ademola Adewoyin. He's a consultant hematologist at Evercare Hospital. Okay, so doctor, let's talk about this blood donation and blood bank and donor drives that you mentioned. So what should we be aware of?
Right. So at Evercare, we have a blood bank and then we have a blood donor center. So volunteers or voluntary donors are free to walk in and request to donate blood. The importance or the benefits of donation, they are quite a number. When you donate blood, you go through some sort of health assessment, so you get some organ checks, you get some physical assessment, and of course that helps to be on top of your numbers as per your health, okay? And then the other big thing about donation is there is a sense of happiness or fulfillment that comes with donating blood.
Okay.
I mean, for everyone that has donated blood before, there is this feeling of self-satisfaction that goes with that. So, I mean, for that alone, I think many of us would...
Reason.
Yeah, sure. Right. So, of course, the other bit about it is that the one bag of blood donated can serve at least 3 donors. So you can save as much as 3 lives with just one episode of donation. So there are also different forms of donation for those that may not be aware. So there is the regular whole blood donation that many persons are aware about, but we also do specialized donations. So you can donate something like platelets, and that involves putting the donor on a machine called the apheresis machine, and that machine is able to harvest or extract just the cell that is needed for therapeutic purpose. So we can collect just platelets. We can also collect just the plasma. For instance, we've had talks about the issue of convalescent plasma in treatment of COVID-19. So that can be collected by apheresis donation as well.
Oh wow, that's quite interesting. I've heard of blood, collecting blood, and I've heard of all the others. But this plasma and platelets is quite a different one. Let's see who this is. Hello, good evening.
Hi, good evening.
Hi, good evening. How are you doing today?
Very well, sir.
What's your name, please?
Okay, my name is Femi. I'm calling you from Surulere.
Okay, Femi from Surulere.
Yes.
Do you have a question for Dr. Ademola?
Yes, I do.
Okay, go on, please.
Yes, so you're talking about blood. I'm in my 40s, and I was talking with a friend casual, and it was like when you are over 40, you should start picking up something to thin your blood, kind of, because your blood gets thick, and when your blood is thick, then it's more prone to high blood pressure and hypertension. So I want to find out, is it recommended for one to just, once you are over 40, to start taking blood thinning drugs as a prerequisite to preventing blood issues later on?
Yeah, thanks for that question. Right, yeah. So, well, we typically do not put persons above 40 on blood thinning medications, except there is a reason to do that. The name suggests blood thinning. So you don't want to thin blood when blood is not, when blood is not clotting, so it's not a typical thing, but I think the point I should mention in relation to that is that regular donation also helps to reduce the rate at which the red marrow becomes yellow marrow. So it tends to reduce the degree of fibrosis that tends to come with age. So donation helps to keep your marrow a lot more active and delays, somewhat the aging process of the bone marrow. Okay.
All right. Doctor, let's talk about babies, shall we? Okay, so an estimated 300,000 babies are born with hemoglobin disorders globally. Now, half of these babies are born with sickle cell disease, and it occurs basically in Nigeria. So, two questions: why is this incidence so high in Nigeria, and also what can be done?
Yeah, so it's because we have, by virtue of where we are, by virtue of what is called natural selection, we have this gene in the African continent, especially the West African region of basin, that keeps steady the level of the sickle gene in our population. Now, that is why we have this degree of babies born with sickle cell disease. But again, we tend to have better diagnostics now, despite the fact that we still don't have what is called the newborn screening. But we tend to see a lot of these cases, and a lot of persons affected tends to live longer with these problems. Okay, so that's why it's a bit more prevalent and more appreciable in our healthcare settings.
All right, just before I let you leave though, in blood disorders in pregnant women, is it transmissible or transmittable now from mother to child? And if it is, how can it be prevented?
Well, it's by ensuring that the right decisions are taken. So clearly, these are transmissible because they are inherited entities. Most of these inherited blood disorders. Now, they can be prevented by having genetic counseling and people making the right reproductive health decisions. So that we don't have instances of AS and AS, and then the chance of having SS is there. So it's as simple as that.
All right. Somebody sends a message here. Angel says, please, do blood thinners prevent blood clot?
Yes, blood thinners can reduce the chance of forming a clot. Correct.
Oh, can reduce the chance?
Yeah.
Okay.
There is no all or none in medicine. So, and several factors are usually at play. So usually it's not as simple as straightforward as that. And I would also, say that there are a bit of some of these mechanisms that we don't even fully understand. But we can track and say, yes, there's association between these entities.
All right, thank you so much for that. We're about to wrap up this side of the show. If you just joined us, where have you been? We've been talking to Dr. Ademola Adewoyin. He's a consultant hematologist with Evercare Hospital. And also, basically, we've been talking about blood disorders. So we talked about, the processes of diagnosing blood disorders at Evercare, and also we talked about the facilities to treat blood disorders at Evercare. So just before we wrap up though, can you just please reiterate that bit for us? The process of diagnosing blood disorders and also facilities that are in place to treat them.
Right, so diagnosis would involve seeing the doctor, having a consultation. The doctor would get some questioning from you, the doctor would examine you, and then the doctor would do a couple of blood works, and then procedures are also involved. We can request to do a bone marrow, lymph node biopsy, and all of these procedures, facilities are available at Evercare Hospital.
All right, thank you so much, Doctor. Just before I let you leave, how can the good people of Lagos reach out to you? How can they get to you and speak to you concerning this?
Sure. So the hospital is located, Evercare Hospital is located on number 1 Admiralty Way, Bisola Durosimi Drive, Lekki Peninsula Scheme 1, Lekki, Lagos. And our website is www.evercare.ng. You can reach us on the phone 081-398-50710. And you can also email us at info@evercare.ng.
All right. Thank you so much, Doctor. Sure. It's been a pleasure having you here. It's been very insightful, I tell you. And Lagos, I hope that you've learned a few things as well. So please reach out to Evercare for all your, all the information that you might require. Okay, so once again, they're located at number 1 Admiralty Way, Bisola Josimi Etsy Drive, Lekki Peninsula, Lekki 1. Okay, also you can reach out to them on their website, which is www.evercare.ng. Also, you can call the number 081 398 50710. Also, you can send an email to info@evercare.ng. Once again, doctor, thank you so much for coming.
Yeah, thanks a lot for having me.
Lagos, there's more to come. If you we have a couple of winners on the show today, so please send in your details. Moses, Bisola, Biebi as well. All of you that won vouchers on the show today, please send your details so we can, you can redeem them courtesy Evercare Hospital. Stay close to your radio. There's more to come.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.